Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.
Hello and welcome to our Community Health Matters Why 2 is Too Late Pediatric Dental segment. I'm your host, Delaney Serfling, and today I am joined here with Dr. Melanie Murphy. Dr. Murphy, why don't you tell us a little bit about what you do here at North County Health Services?
Hi, pleasure to be here. I'm a general dentist and I've been practicing for about 15 years, 5 of which has been with North County Health Services in San Marcos.
Wonderful. So why don't you tell us a little bit about why 2 is too late?
So 2 is Too Late is an initiative whereby we encourage parents to bring their children to the dentist by 6 months of age when they cut the first tooth. When we see kids that are being brought 2 or older, we typically see that damage has already been done and it gets very challenging to correct those problems, such as cavities on such a small child. And before 2 years old, we really like to establish some good oral health habits at home so that we set kids and parents up for a lifetime of healthy mouths.
Okay, so you say cut the first tooth. What does that mean for our viewers that are watching today?
Cut the first tooth means the first tooth is entering the mouth. That typically happens around 6 months of age.
Wonderful. So why is dental care for children really so important?
So I think for a lot of the parents that I see, there's a common misperception that they're just baby teeth. Nothing can happen. The contrary, cavities can form, gum disease can form in children as well, and they're just as debilitating and just as painful for children as they are for adults. So it's important to incorporate good oral hygiene habits at home at an early age, as well as begin bringing the child to the dentist from 6 months on and every 6 months so that we can monitor progress and red flag any challenges that the parents and family might be facing with cavities and development.
So you hear a lot about preventative services now. So what exactly do preventative services for children under the age of 2 for dental treatment look like?
So I like to think of preventive services as being in 2 camps. There's the preventive services or preventive work that goes on at home, and that's part of our job is to teach parents about that. And then there's the part that happens at the dental office. In the dental office under 2, we typically do a thorough examination of the mouth as well as a cleaning. We look for problems while we're cleaning the teeth, and then a fluoride application. But beyond that, the majority of our appointment is to discuss education points with the parents, such as how to care for the teeth, when to start caring for the teeth, how often, and then also the nutrition component to prevent cavities.
So obviously you see a lot of children in the clinic. You see some that are coming in before they're 1, you see some that are coming in before they're 2, some that are waiting maybe until they're 5 years old for their first appointment. So what are some stories that you've seen in the clinic for these different kinds of children that are coming in for their first dental appointment?
I would say across the board, the most common thing that parents tell me is, my kid won't let me brush their teeth. And there was a time when in the back of my mind I would be saying, parent, who's in charge here? Now that I have my own children who are 11 months and 2 years old, my children can cross the room like the speeding bullet when I pull that toothbrush out. So I know what they're talking about. So one of the advantages of coming to the dentist is we can show parents techniques to get, I wouldn't say to cooperate, but we get the child to get the job done.
So you're saying that parents out there that aren't dentists should not feel so bad because you have problems with it too?
No, not at all.
Wonderful. So what exactly happens at the first dental visit when the kid comes in, little kiddo, and they're probably pretty scared? So just to kind of put everybody at ease, what do you do at the first visit?
So typically you can expect to have an examination done, a cleaning done, and if the child's old enough, x-rays as well. When we talk about 2 under 2, that's usually a visual exam without the x-rays. It's a little too much for children to tolerate the films in their mouths. But a lot of education takes place during that first visit for the parents to help prevent problems down the road. When they're a little bit older, we start incorporating x-rays. We might use some of the electronic toothbrushers like the polisher. And so we talk to the kids about what we're going to do before we do it. So there's a little bit more relaxed environment.
So how exactly do you make them relaxed? Do you make them comfortable? How do you make it fun?
So we have a few tools that we use, little techniques. The best one that I like in our office is the No Cavity Club. So when kids come in on a regular basis and they start to see they have no cavities and their gums are healthy, they get a little certificate that they can sign their name and then put it on the wall under the No Cavity Club. And then they get a little certificate to take home with them to put on the refrigerator. And then of course a trip to the treasure box. Outside of that, we also have the first-year birthday parties where we invite all of our 1-year-olds, first birthday kids, and they get to have a little party with balloons and healthy snacks, and then we do a dental screening on the kids and put some fluoride on their teeth.
Okay, so at the dental screening, other than the fluoride application, what goes on during the screening at the birthday party?
Education, education, education.
So that's for mom and baby.
Yeah, I mean, mom's going to take home the message. Baby gets to lay there.
Or dad, obviously.
Or dad.
Great. So what exactly should the parents be doing to prepare not only their child, but themselves for that first visit?
Okay, so most parents have had a dental visit themselves, and they are aware that the first visit typically is an exam and a cleaning, and sometimes x-rays depending on the age of the child. What I have found to be the most successful thing for parents to do is to role play at home first, so that it's not so unfamiliar when they come in the door to see us. So I've had parents say, okay, Johnny, the dentist is going to count your teeth. Why don't you lay down and I'll count your teeth, and now you count my teeth. And then they do the same thing with brushing. Johnny, I'm going to brush your teeth like the dentist is going to clean your teeth. Now you brush my teeth. And so the kids who have the role playing going on and they kind of know what to expect, they do much better.
And they can also learn how to count.
They can learn how to count.
Great. So what dental services specifically does North County Health Services provide, and how do they make those services accessible for everyone? Sometimes we know what our child needs to have done, but we don't know where to go, how to get it. So what does North County really do for that?
So your first question was, what do we offer? We offer family dental. I mean, the whole spectrum between exams and cleanings on little guys to fillings on little guys and adults, cleanings for adults, bridges, dentures, the works. As far as access is concerned, we have a transportation service for parents who don't have transportation that will pick them up for their appointment and then bring them back after their appointment. We also have translation available. Most of our staff, or large majority of our staff, is bilingual, English, Spanish, but on top of that we do also have some other languages spoken in our offices, and then finally we have a translation service so that parents feel like they're able to communicate with the provider effectively. We also have a call center that parents can call to help them navigate their appointments as well.
Great. And I think that through that call center, there's also a cancellation line, or is there, and they can help them schedule there?
Yeah, they can help them cancel their appointments and reschedule as well.
Because sometimes just calling in and waiting on hold for so long can be so difficult. So it's awesome that you guys have a great call center there. So how do you really bring those services outside of the clinic? I know that there's lots of people that come into the clinic, but North County is really large and we have a lot of patients that can't always make it in.
Right, and especially for the little guys. So we have a mobile dental clinic that is complete with a dental chair, and we do go out to schools most commonly. And for the parents who have okayed it, we do dental screenings and fluoride varnish on these kids. These kids will go home with a report card for their parents that explains what we found and if we think that any dental needs, or we see any dental concerns. And then on top of that, we take a report card back to our offices, and we have a team that reaches out to these parents to help schedule their appointments for their kids' checkups.
So when this team calls the parents, do they also talk to the parents about maybe getting them in as well? I mean, I know that sometimes those parents are looking for appointments.
Right, and as we've also learned, if a child is in an environment where the parents have a lot of decay and gum disease problems, the bacteria is being transmitted to these kids, so the healthier the family's mouth is, the less risk for cavities and gum disease the child will have.
So talking about that, there is kind of a topic of what to do before you even have your first child, you know, when mom's still pregnant, and preparing before they come in for that first appointment.
And you know, this whole 2 is too late campaign, in my heart, I feel like it starts with mom. And when she's pregnant, if we can get mom's cavity level to 0 and her gum disease under control, she will have so much less bacteria to transmit to baby when baby is born, so that child will be less likely to develop gum disease and cavities as well.
Do you find that there's some barriers sometimes to pregnant women wanting to come in, though? I know that there's some fears sometimes about x-rays and what can be done while they're pregnant. So what are some barriers or maybe some common myths that you've heard about?
Right. So the guideline is no elective treatment when women are pregnant. And certainly there are some concerns about certain things. I wouldn't want a woman bleaching her teeth while she's pregnant because it's just not necessary. But again, the healthier mom's mouth is when she's pregnant, the less bacteria is being transmitted to the baby when the baby's born. Deep cleanings are not a problem. They're actually beneficial. We found that women who have gum disease, more advanced gum disease, are more likely to have preterm babies or lower birth weight babies. So it's important to get that addressed while they're pregnant.
Great. So that's that preventative care before the baby even comes. So what is kind of your favorite thing about what you do? I mean, you do so much in North County, you see all kinds of different patients, but when you leave at the end of the day and you have something that just makes you feel good, what's that?
Well, when it comes to the kids, I like seeing a happy visit where there's not a lot of crying, there's trust that's been built up, and that starts so early. So if we can get them in when they're really young and they start seeing that the dental office isn't a scary place to be, that it's a place where happy things happen, and it's just part of life. You know, you go in for your checkups with your doctor, you get your eye exams done, you go to the dentist too, and then it's not a scary thing for them, and so that's rewarding for me.
Yeah, and when you have those kids come in with their parents and it's a dental home for everyone, it kind of puts them all at ease, right?
Right, and then you treat the whole family.
So you see the mom and dad and all the kids coming in. Do they compete to get the star on the wall?
Well, I haven't had a dad or a mom ask for the star on the wall yet.
I might ask for it.
But the siblings might.
Wonderful. Well, thank you so much. We're going to take a quick commercial break, and when we return, we'll be having Dr. Carmel Murphy joining us.
Hey, Hard, what's this?
That's my resignation letter.
You're resigning.
Why? Because you're constantly ignoring me. You're half as active as you used to be, and you get stuff like this. You've been putting me under a lot of pressure lately. That's why I'm ready to quit.
I forgot. I'll do better. Please, don't quit on me.
Okay, but remember, it's not what you say, it's what you do.
Listen to your heart. Don't let it quit on you.
Let's go for a walk.
Uncontrolled high blood pressure could lead to a stroke, heart attack, or death. Get yours to a healthy range before it's too late.
This is the story of a boy who is very sensitive to lights and sounds. So he built secret hiding places where nothing could get in. The boy didn't like looking people in the eye. It made him feel uncomfortable. One day, he found out he had something called autism. His family got him help. And slowly, he learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Welcome back to our Community Health Matters series. We're discussing why 2 is too late for dental care, and we still have with us Dr. Melanie Murphy, and now we have another Dr. Murphy, Dr. Carmel Murphy, who's a pediatrician here at North County Health Services. Welcome, Dr. Murphy. So why don't you tell us a little bit about what you do at North County Health Services?
So I'm a pediatrician at our North County Health Services Encinitas location. So I see babies from 0 to 18. So literally within hours of birth, I'm often there to see them and take care of them from their sick visits to their well child needs.
Great. So what exactly do you see is the impact on dental care and nutrition on kind of the overall health of your little kiddos?
Well, nutrition is hugely important, especially in our population, and a lot of times I'm seeing children who are exposed to things like juice at a young age or soda beverages at a young age, and those sorts of things, when you start to consume them as early as 6 to 12 months, they absolutely have an impact on one's oral health and can unfortunately set a child up for a future of dental decay.
Yeah. So here's a question kind of for both of you, is looking at the nutrition for dental health, and how does it affect kids when it actually comes to how they are in school and how they interact with each other? Because sometimes people don't think about how dental care might really impact kind of the growth and education and interaction with each other.
Go for it.
So, cavities from poor nutrition can be painful, and what ends up happening is kids have a hard time when resting at night because they're hurting. They don't eat well because it hurts. They don't brush their teeth well because it hurts. And then when they go to school, they have a really hard time focusing and paying attention to the teacher or whatever activity they're doing because it hurts. They're distracted. These kids often miss school as well because of emergency dental issues. And then when you're talking about the little guys, they usually learn by play-based, and they have a hard time also playing well because they're not feeling good. And so we look for those things when we're talking about their ability to go to school and learn and do the things that they need to be doing as kids.
So, if you're a mom and you're packing your child's lunch and you're getting them ready to go off to school, what are some healthy snacks that maybe you should pack, things that you could avoid, maybe some preventative foods that are bad, maybe some that are good, so that these kids can kind of try to keep their teeth in as great a shape as possible for when they're in school?
Yeah, and that's something we touch on every visit with the under 5 group, every exam visit. And when I was growing up, it was candy and soda. We knew not, those were the bad ones, ice cream, cake. But it actually extends further than that. So when we're talking about cavities, what causes a cavity is the bacteria in the mouth. And the bacteria's job is to squirt acid on the teeth, which causes the cavity. And the bacteria gets going by ingesting carbohydrates. So it's not just sugar and candy and things like that. A carbohydrate is crackers, it's pasta, it's bread. So if a child is snacking on these things constantly throughout the day, they're getting one acid attack after another, which causes cavities. So I say a rule of thumb is after 20 minutes since your child has had a snack, if you still see food particles stuck in their teeth, that might be a snack that you want to limit and not have them snacking on all day long. My kid's favorite is Cheerios, and yay Cheerios for your heart health. Maybe you want to limit the snacking on the Cheerios because they do stick in the teeth and they are a carbohydrate.
Do you find that there's ever any issues with actually how long they suck on the bottle for? You hear about things like bottle rot, I think it's called. So what should moms maybe know about as far as bottle feeding babies?
So with the bottle care, when the baby is asleep with the bottle in bed, what they tend to do is for soothing reasons, they'll suck on the bottle. They'll ingest a little bit of the milk, but a little bit of the milk stays on the teeth and the gums all night long as well. And the bacteria start using that, and that's when all the damage is done, or a lot of the damage is done as while the child's sleeping. So we would recommend either removing the bottle as early as possible. And what age would you recommend removing the milk bottle from?
Yeah, generally not beyond a year of age, so 12 months old.
And if kids are, what we tell patients is that if their kids are having a hard time sleeping at night and they like that sucking, soothing, then water. Because water won't hurt their teeth.
Okay. Now, Carmel, when kids come in to see you before they're 2 years old, obviously it's not for their first dental appointment because you're a pediatrician, not a dentist like Dr. Melanie over here. But what exactly are you looking for? Because you probably look in their mouth and you're thinking, do I need to refer them over to a dentist? So just from a pediatric standpoint, what are you looking for?
Teeth. If they have teeth in their mouth, they can go to the dentist. No, it's true. It's actually true. And honestly, it's before teeth, actually, because as soon at the very first visits, I'm telling parents to start getting in the habit of cleaning your child's mouth. And obviously, most babies don't get their first round of teeth until about 6 months old. But prior to that, I'm telling parents to use a wet washcloth and clean off the gums at least once or twice a day. Whether or not that's beneficial, dentally speaking, it is beneficial to creating a good habit so that hopefully the transition is much easier when they're making the change to an actual toothbrush. So yes, teeth in the mouth are kind of my tip off that it's time
to go.
Now, you are both moms and you both have young children. So maybe you could tell us a little bit about when you had to bring your little kiddo to the dentist for the first time. Melanie had kind of touched on it a little bit. But what were your reservations as a mom with your child bringing him in? Were you nervous they were going to scream and make a scene and everyone's going to be hearing? What were you kind of worried about?
My baby has yet to go, and I won't say how old she is. But no, I think my concern is that I try, and I heard Dr. Murphy saying earlier, I try really hard to brush her teeth, and it's not easy. And so I think my fear is, knowing that I've seen babies with cavities, my fear is, could my baby be one of those babies? You know, she likes to eat certain foods that can stick on the teeth, like raisins, Cheerios. And so I think my fear is, you know, I do hope she has good teeth when she goes to the dentist. And she's feisty, and she might put up a fight when it comes to being in that seat and seeing the dentist.
So for my child, I brought my older one, who's 2. And I brought him probably when he was about 7 months old, and I expected a little bit of a fuss, and boy did I get a fuss. So it's universal, and nobody's immune. Some babies are angel babies, the majority don't want you in their space, and it's a very invasive place for kids to have you in.
So, Carmel, do you see that when babies are coming in to see you and parents are bringing them in, are there any barriers maybe to come in for their first visit with you, and you're trying to refer them over to maybe one of our dental locations? I know your office is in Encinitas, and we have offices that are in San Marcos and up in Oceanside and out in Ramona. But what are you looking at that might be a barrier for patients that are coming not right by where our clinics are?
Well, I think one huge barrier for our population is it covered? Will the care be paid for? Will my insurance pay for it? And for the most part, with children who have Medi-Cal, yes, the care will be paid for. So that right there is a huge burden that is removed from them, so that they know that they can go and get that care. And then I think once they actually hear that, then they're motivated actually to go and do it. I think it was the concern previously about their ability to pay for it that interfered. And so I think Oceanside is not too far from Encinitas. And I do think the parents obviously care deeply for their children. And when I oftentimes will communicate to parents, you know, as soon as they have teeth, they can have cavities. And that comes as a shock to parents. They don't realize that baby teeth could get cavities. And I've seen far too many that do. And so I think just getting that message is the impetus they need to go and get the dental care.
Agreed.
Do you find that sometimes they think since those baby teeth are going to fall out eventually, it doesn't matter, because then the adult teeth will come in and those are the ones that stick around?
Right. And that's a misconception that we commonly hear too. And so one of the things we talk about is the pain issue, the school issue. On top of that, kids know when they have discolored teeth and they don't look like everybody else. And these kids sometimes don't have confidence to go out with their peers and smile and play, and it's very sad to see. And then the other thing is when they lose teeth prematurely because of cavities, sometimes the speech is affected as well.
Well, thank you so much for that. Those little kids have a lot that they have to be dealing with. I mean, I didn't realize there were so many things that could actually be affected by it. But you get to give them beautiful smiles. So you kind of had mentioned about the insurance. I'm just wondering, do you have a way for people that maybe don't know how to navigate that? If I don't have insurance and I need insurance for me and my baby, do you have somebody that can offer those services?
Absolutely. Yeah, at North County Health Services, we have a whole crew of people who help with insurance issues. And at Encinitas, we have someone who's right there in our clinic who, and specifically there's additionally dental programs. Should they not qualify with their insurance, there's dental programs specifically for children that can help to get the care they need.
Well, ladies, thank you so much for joining us. We're going to be taking another quick commercial break, and we'll be back in just a little bit.
When I was 6, I had one thing on my mind. When I was 6, my days were spent playing basketball every chance I could. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke.
I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery.
Protect the ones you love.
Spot a stroke. F-A-S-T. Fast.
Welcome back to our Community Health Matters program on why 2 is too late for dental services. I'm back here now with Tracy Hatanaka, and Tracy is here with our WIC department in North County Health Services. So Tracy, why don't you tell us a little bit about what you do and what WIC is?
Sure. So I'm a dietitian with our WIC program, and as a dietitian, I get to provide nutrition, education, and counseling to our participants. And also we do a lot of breastfeeding support and promotion. We work with a lot of community programs, so we like to refer our participants to any services that they may need. The WIC program is, if for those that don't know, is for women, infants, and children. And it's intended for low-income populations. The population that we serve are women that are pregnant and breastfeeding moms. And also we see babies and kids up to their 5th birthday.
The 5th birthday. Great. And now there's WIC offices that are all over the place, right? And we have a bunch of them that are actually in North County. Can you let us know kind of where some of the offices are up there?
Sure. So I'm actually in our Oceanside office, and I also work in the one in Encinitas. And we have other sites in San Marcos, Escondido, Borrego Springs, Valley Center, and Ramona. So we have 7 sites total.
So you're busy.
Yeah.
Great. Well, we really wanted to talk a little bit about the nutrition side. You know, we had talked to Dr. Melanie Murphy and Dr. Carmel and kind of went over what the healthy foods maybe to have and not have are. So what are some things that you do specifically for nutrition services for dental care for these patients that are coming in?
Yeah, so with our participants that come in and receive nutrition counseling from us, we do ask them if they have a dentist that they're seeing regularly, and if not, we make referrals for them. We have the North County Health Services mobile dental team comes to 3 of our sites in Oceanside, San Marcos, and Escondido every other month, and they provide free dental screenings for our participants right in the office. So for a lot of our participants, it's maybe their first time that they'll get to see a dentist, because they'll even see some of the babies if they have their first tooth in, and they'll also see some of our pregnant participants as well.
So sometimes these kids that are coming in for their first dental appointment is really in a WIC office, that they're coming in for these screenings.
Right, and so it's pretty cool. They do the screening, they get a fluoride treatment, a little goodie bag at the end, and it's supposed to be, you know, just a easy, simple screening for them, not, you know, intended, of course, to scare the kids too much, and just kind of get them used to seeing a dentist.
So when they come into the WIC office, can they sign up for those screenings there?
We do have signs available in our offices of when the dentist is going to be coming, and so we try and make a point of it to let the participants know, so even if they don't have an appointment that day, they can stop in and see the dentist.
Great. So what is it exactly about your job, kind of what you find is the most rewarding that you can actually do, especially for these little kids under 2, to let them know how to take care of themselves at a young age?
What I really like is with WIC, you get to see participants, you know, the pregnant moms, and you get to follow them along after they have the baby, and then you see these kids now that, you know, running around the office, and they're just so happy and everything, and you get to be a part of that. And they come to you, you know, we get people that come in and they'll say things like, you know, I wanted to introduce solid foods to my baby, but I wanted to wait and see what you guys had to say about it first. And so they really value what you're saying, and you kind of build a good rapport with them, and they feel comfortable asking you questions and sharing their experiences. So it's really nice to get positive feedback from them, for sure.
So you do OB services there as well, right? So you have these pregnant moms that are coming in, and kind of how we discussed before, those preventative care can happen before the child even comes. So what kind of education do you give pregnant moms?
Right, so I get to work in one of our OB clinics in Oceanside, and so I see women typically once a trimester during their pregnancy, and then once or twice postpartum. So we really focus on nutrition. So we talk about what they're eating and trying to help them achieve an ideal weight gain throughout their pregnancy. making healthier choices with their situations that they have going on, and really just trying to help them come up with individual goals that are going to just help them have a healthier pregnancy and healthier outcome.
Well, you definitely do great things for our community, and North County Health Services loves working with WIC, so we appreciate everything.
Oh, thank you.
So thank you so much for coming, Tracy. And we're going to be ending up this segment on why 2 is too late. If you need additional information, you can call the North County Health Services line at 760-736-6767, or you can go online to the website at nchs-health.org. Thank you so much.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.